Today's event is being hosted by the Vanderbilt Project on Unity in American Democracy, which is a nonpartisan initiative designed to bridge our national divisions and strengthen the pillars of our democracy. The Vanderbilt Project on Unity in American Democracy seeks out viewpoints from across the political spectrum to help find genuine solutions to the challenges that affect us all. Today's conversation is designed to provide evidence-based information that we hope encourages those who remain hesitant to consider getting the vaccine.
So why? Let's go with the first question. Why is misinformation about COVID-19 deemed as an infodemic by the World Health Organization, posing an imminent threat to our nation's health, and what is causing this proliferation of such misinformation?
Probably back in the polio days, there probably was misinformation, but the news didn't spread so quickly, right? But now you can find people who quickly spread misinformation, can put it on social media, can be very savvy, and people go out looking for ideas that fulfill their own biases. And so I think our biggest problem is we have not taken enough time to think for ourselves sometimes, and we're letting people who may have ill intent have platforms that previously were not available to them.
Helping speed the development of the coronavirus vaccine may be one of President Trump's proudest accomplishments. But as research from the Vanderbilt Poll and Pew Research Center attest, a substantial number of Trump supporters resist vaccination. What can be done to overcome this hesitancy?
It's hard to explain why there's some degree of hesitancy, but I will say this, and Dr. Rose on the panel here, I do believe this is a decision between a patient and his or her physician. That's how this decision should be made, not the federal government telling us what to do. I think it's a very personal decision.
Is the infodemic fueled by partisan politics, or is there something bigger at play here?
No, I think it is fueled by politics. And unfortunately, the pandemic had to occur during an election year. So you could see that happening, and it still is, unfortunately. And after almost 40 years of practice in medicine, I've never operated on a Republican or a Democrat cancer in my life, but I've operated on plenty of them. So it affects all of us, regardless of party affiliation. This virus is a nonpartisan infector of everybody.
Well, thank you for participating in this timely discussion. I know our audience appreciates these key takeaways as we fight to curb the spread of COVID-19 and keep our families and our communities safe.